In terms of our preparedness for pandemics, as a country, we've tested our plan on 2-3 occasions. The last one was in 2009 during the pandemic outbreak. We were able to contain it. We were able to develop and implement our surveillance programs. We were able to put the case management programs in place.
We actually got ourselves organized based on the SARS scare, avian flu, and then, of course, the pandemic influenza H1N1.
GIZ is a German state-owned implementing agency on behalf of the German Federal Ministry of Economic Cooperation and Development. So why pandemic preparedness? Why are we partnering with the Ghanaian government, with the private sector, with the civil society? 2009 we had the pandemic influenza outbreak. And I think we all have seen that Ghana was not fully prepared for it. And if I say fully, it means every institution, private, public, civil society. So then the initiative started with NADMO, the National Disaster Management Organization, with the Ministry of Health, and see how can we have a holistic approach to address pandemics.
WHO role in pandemics and epidemics and outbreaks are mainly to provide leadership in health and disaster response.
Pandemics can be local in origin or foreign-born. Both scenarios demand vigilance, coordination, and rapid deployment.
If Ghana Health Service confirms that we have a virus in this country, they will definitely alert NADMO. Now, NADMO is a central coordinating body for a response to a pandemic. Upon confirmation of a virus in this country, NADMO will call a committee of experts who will sit down, strategize on what to do, how to respond to it, what are the needed resources. NADMO will be in the front line to get the resources to be able to respond to any outbreak in this country.
In a highly globalized world, the external threats are many and varied.
The Surveillance Department is responsible for holding vigil of all the outbreaks, epidemic-prone conditions and diseases in the country, Ghana. We have systems in place to detect, to make sure that there is early detection of any outbreak, there is early notification, and share information with all partners.
And we have agencies that we work with, very close collaboration, Port Health, NADMO, Veterinary Services Department. Health issues are cross-cutting, and we work closely with these people to do the needed risk assessment.
So our surveillance system, we have a system that works from the community level, the sub-district level, the district level, the regional level, to the national level, and the international level. At the community level, you have community-based surveillance volunteers. These are people selected by their own people, their own community heads and community leaders to keep watch of emergence of conditions that are not usual. When you're talking about viruses in country, we work closely with the Noguchi Memorial Institute of Medical Research.
Scientific analysis plays a critical role in pandemic detection, control, and eradication.
The role of Noguchi in the pandemic has been basically providing lab diagnostic support to the Ministry of Health, Ghana Health Service. We drew up a plan for collecting respiratory samples from patients who who were suspected to have, influenza. And these samples were collected according to a specific procedure using throat swabs into virus transport medium. We facilitated the transport of these specimens to Noguchi. We received them, and initially the samples are processed. What we do is that we extract the material which will enable us to identify the influenza virus. And most of the processing is done in this controlled access laboratory here at Noguchi. We aimed at getting a 24-hour, return of the results. The process actually takes about 6 to 8 hours, and then we will be able to report back to the Ghana Health Service and the specific hospital that sent us the sample, whether the sample was positive for the influenza virus and what type of influenza virus, the patient had been exposed to.
Business continuity planning is an essential component of pandemic preparedness.
During the influenza pandemic, there was a need for us to evolve a program that would be able to contain such situations. Fortunately for us, before then, we were in alliance with the GIZ to roll out a lot of programs in terms of dealing with the HIV, AIDS, diabetes, high blood pressure, and the kidney problems. So there was a need then for GRA to evolve a system that can cater for other risks. And then what was the strategy? The strategy was to identify the key risk factors and to determine the key activities in terms of resources, in terms of the human capital, and then to find out how we can respond to the situation when there's a pandemic. So we formed a core group. They were trained, and it was their responsibility to go around to sensitize all the staff, both managerial and non-managerial levels, so that everybody will be part of the process. We are a revenue-generating organization. And then when there's a long disruption, it will affect the state financially, because that is the main source of revenue for government to finance its activities. So we said we need to develop a continuity plan, a business continuity plan. That has been developed.
As a utility organization, we are all prepared for any pandemic situations. For example, if there's any contaminant or a pollutant that have been dropped into the water body that we extract for treatments, the first thing we have to do is to shut down the water treatment plants that draws the water from that source and inform the general public about the situations and the steps that we are taking, the necessary steps we are taking to rectify the situation.
Pandemics demand the deployment of various forces on a national and global scale. That is why the first international conference on pandemics is important.
Ghana's first international conference on pandemics. We are very happy to, we as GIZ being a development partner, we are very happy to partner with NADMO, with the Ghana Health Service, Ministry of Health, to support the organization of the first international conference on pandemics in Ghana. Why? There's a need to address pandemics, there's a need to exchange information, there's a need to learn from each other, there's a need to bring other countries in to have a forum, a platform where we can exchange our knowledge, not only in these 2 days, but this should be a kickstart for ongoing exchange of information. So I think Ghana can be also proud to have this type of conference here. We have to get the whole society being prepared.
Preparedness is a process, it's not an event.
So we really need to be prepared.
Being prepared means being alert to the signs, symptoms, and occurrences. Being prepared means timely and effective communication at all levels. Being prepared means having the right personnel and logistics in place. We must all be prepared.
Pandemic preparedness, our responsibility.